everyone, this is Dr. Sulochana Gurung here, dentist, and I'm here with another episode of To Talk Thursday. And yes, I'm super excited to be here. Okay, so the topic today is bleeding gums. Y'all must be wondering why gums bleed and what you guys can do about it. Before beginning, I'd like to talk a little bit about our practice. We are a brand new dental office here in heart of Queens, New York, and we are located on 8710 Northern Boulevard, Jackson Heights, Queens. Yes, we 204, and again, this is a brand new facility, and we are almost towards the end of construction. So I'm, I cannot wait to meet you all and share or show you, show the place around. So yes, you all must be wondering why gums bleed. So before I go over deep in the topic, let me just talk a little bit about what your teeth, what is the anatomy of the tooth. That way it'll be a little clearer towards the end, towards the later section. So what happens is gums, they are a soft tissue protecting, that covers the bone and the tooth and a part of the and the roots of the teeth. So where the tooth and the gums meet, they have a little opening which is called gingival sulcus. So these sulcus, they have something called gingival crevical fluid, which is it has a high enzyme and which has a cleaning capacity. So what happens is, as normally they'll be oozing out the gums and cleaning your teeth naturally. At the same time, if you do not clean your teeth, or when if anything lodges in between the teeth and the gums, or in between teeth to teeth, what happens is your body, our body, it tends to think that, oh, this is a foreign body, so foreign object, so it'll tend to fight against those accumulations or bacteria in the mouth. So eventually what happens is the blood vessel, the tiny blood vessel in between in the gums, the surface, these are called gingival capillaries, so they tend to swell, and then this causes bleeding. So it is normally it's not normal for the gums to bleed, but it's okay for the fluid, when it's releases, it kind of cleans those bacteria and the plaque and tries to prevent, make the tooth, the gums, healthier. So when there is imbalance between, when there is a lot of lot of plaque accumulation, and if you're not cleaning them well, the host response diminishes. That means we cannot, the body cannot fight that, and then it leads to bleeding eventually. So in order to prevent that, there are a lot of variety of measures that you can adopt. So the first thing would be, and the first and foremost, and a very easy practice would be brushing your teeth twice daily, flossing every day, and especially those in between those teeth where you tend to pack a lot of food. And what it does is it clears those particles, and then decreases that inflammatory procedure, or your gums fight, or those body fighting against that fighting against them. So yeah, oh, thank you for all the love and likes. Yeah. So yeah, so that's that's the best thing you can do to your body, brushing your teeth and flossing. And there are a lot of aids available to clean in between the teeth. It can be a regular floss, proxy brushes, self picks, and there are oral irrigators which you can just buy off the over the counter. Use some water or some mouthwash, and then try to clean in between the teeth, or just try to irrigate your mouth. And there are also water picks available. So yeah, those are a variety of things you can use. The other would be again, to get a professional cleaning. So about professional cleaning, let me just go over a few things. I know you all must be wondering, when you go see a doctor or dentist, once you get the cleaning, that cleaning does everything. So how we categorize like type of cleaning when you come see us is it depending on, you know, what you'd be needing. So it'll be all customized to your need basically. So like initially when I was talking about those gingival sulcus, that's a little separation between the teeth and the gums where those the gingival fluid oozes out. So in the event when you cannot, like you're not brushing well, so it kind of increases in size. So anything between, a 0, 1 to 3 is, that's something you can clean by regular brushing. And then we can clean by doing a routine prophylaxis or a normal regular cleaning. So if anything that goes past 3, so let's suppose like the gingival pocket, if it is around like 4 to 5, that's when we recommend you guys getting a deep cleaning. So what deep cleaning is it is also called as scaling and root cleaning. So we have to use our special tools to get in between, in between those pockets, deep underneath, and then it will be a little uncomfortable. That's where we tend to give you anesthesia so that you won't feel that. So that's another, that's another level of cleaning. The other one would be if we cannot, if anything more than 5, 6, we cannot reach with our regular hand instruments or the prophy tips. That's where we tend to, there are other measures available to clean those areas. It can be surgeries, or it can be using lasers, or it can be, we have to like cut the gum open, clean in between those areas, and then suture it back in. And we also do it with some adjunct medications like antibiotics or special rinses or special products that can be used along with that treatment. So those are like those are a little advanced level of treatment that we can provide you as well. So yes, so just the moral is like not all cleanings are same. And again, the cleanings, if we do routinely, regularly, and if everything is, your host defense mechanism in the body is okay, and everything is fine, then regular brushing and a 6 months cleaning 2 times in a year is sufficient for you to maintain your gums. And again, in the event if you need deep cleaning, we would recommend you getting the 3 months cleaning, or it's also called a periodontal maintenance. What it does is it tends to get rid of those accumulation, tartar, and those periodontal pathogens that tends to grow fast. They are eradicated, and that way we can help reduce further prevention or further breakdown of those deep pockets, and it's more of preventative sides. And again, this month is all about prevention. That's where I just wanted to share a little bit about cleaning, which is the first preventative measure that we take in order to maintain good oral health. So yes, if you guys have any questions, you can always put them in the comment section below, and if I don't get it now, I can always answer them later. And again, if you have any questions regarding anything, or if you'd like me to talk about any topics, I'm always here, and do send me messages to let me know. I'm glad you guys are excited, and so am I, and we will see you soon. Bye-bye. Take care.